fever,
Yes.
cancer, spread cancer, or active hemorrhage. You got a kind of clot, ban or stop the hemorrhage. You make it increase temperature, increase heat, and what is happening? Hemorrhage is going to be active again. So heart failure, a person who got a kind of a stroke, heart failure, you cannot use the local the area. After X-ray treatment and PAD, peripheral artery disease. After X-ray treatment, why? Because you got a kind of X-ray irradiation, and when you are using heat, it might be lead to increased effectiveness of radiation, and because of side effect of radiation, it's going to be a little dangerous. So exactly after radiation, X-ray, don't ask the patient come back for kind of physio or probably heat devices or anything else. Did you get my meaning?
Yes.
Okay.
So PAD.
Peripheral artery disease. Peripheral artery disease. Okay, different type of the electro, you know what is that?
Yes.
We bought a luxurious one for you
Paraffin.
in the building. Parfum bath. And contraindication, why is duplicated? I'm not sure. Okay. For the contraindication of the shorter diameter, this is DP, this is superficial, the last one. Eye cavities, any kind of cavities is a kind of contraindication. You know, you read it in electro, right? Okay, pregnancy. We don't know what is happening for the infant inside of the mother body. After a laminectomy, because it provides laminectomy, you know, detach some kind of herniation in the disc. Yes. After laminectomy, it's a kind of surgery for a short period, probably 2 to 5 days, inflammation stage. If you provide heat, it increases the level of temperature. Good? Septic disease, what is happening? Septic? Bacteria, virus, bacteria. Okay? Bacteria. What is happening with heat? Come on, septic disease. You spread the bacteria. The bacteria does not have brain to identify actually, the heat does not have a brain to identify this is bacteria, this is normal cell. So they activate it by heat. Okay, carotid sinus, because it increases actually the diameter of the vein or artery and decrease the level of blood pressure. And pacemaker and fixator. Fixator is a kind of barbecue.
Yes.
We said that. And pacemaker inside of the heart.
Yes.
So if you use heat, they regulate the pacemaker. Okay. Good. Indication, just let me review it, don't waste the time. Electrotherapy indication might be for cold therapy, cryotherapy. We can affect with the inflammation by cold therapy, decrease muscle spasm, spasticity. What is the difference between spasm and spasticity?
Spasm in the nerve. And spasm
Peripheral
in the
nerve,
yes.
spasticity in central nervous system. Swelling, you can decrease swelling for sure. Pain after organ limitation. After you provide a kind of hold the legs, contract the legs, you can provide cold therapy to decrease the level of pain. And for the contraindication, again, heart failure for cryotherapy. Heart failure, open wounds, peripheral artery disease, sensation disturbances, and nerve regeneration. Just 1 point in open wounds, probably decrease rate of transfusion, decrease with cold pack, decrease the level of transfusion, and as a result, the amount of the blood going to be decreased at the area. They will be at risk of probably a lethal dangerous of necrosis or probably something forced, for instance, amputation or something like that. Necrosis is better to say that necrosis. Okay, stretch and stretching. This method is, again, is heat or cold? Is heat or cold? Again, it's cold. Through the stretching, you can actually provide the lower amount of temperature. Sometimes some of the spray does let you to have increase in the temperature, but it's not common. Again, you have the indication and contraindication here, and you have the indication of a stimulation. Lots of stimulation, 6 or 7 type of indication. You heard it. You read it last semester. Yes, last semester. Yeah. Better circulation, healing process, spasm, stimulation of nervated muscle. You remember the STC? What was that? STC? It's a kind of cookie, I don't know. STC. Ula, second Ula. Which one is second? You are the first? No, every you are first. Okay. STC, what was that? You were not here last session. You lose 10 marks. Ask my name. What was that? STC, come on. Over here. I'm so awesome. A strength duration curve. A strength duration. Do you remember Reubas, Kornaxi? Haven't heard anybody. Your teacher, your professor didn't explain it for you. Say that when I'm not here, you can say that. But not now, because I know I explained it for you. Reubas, Kornaxi, Reubas, Kornaxi. You put it on yourself, try to get it, check it with your classmate. As this is strength duration curve. You do remember strength duration curve? Oh my God. I will get another nice quiz next session, which I will have with you. Okay. Contraindication of a stimulation, again, infection, cancer, both of them lead to provide a kind of spreading cancer or bacteria, something like that. Peacemaker or pregnancy, we don't have any idea what is happening for the infant. Okay, for the tense, how many tenses does we have? You read it through the electrotherapy by Dr. Let's pass it. And the other electrical stimulation is including nothing. IF, come on, what is that? Interferential, right? Didi? Who is Didi? Come on, be brave. Dynamic. Bernard current, dynamic current. You got it? This is the first time you have heard something. Dynamic. So it's type of the galvanopharadic, type of short duration, long duration, actually stimulation. We talk about that. And HV, no, it was not in your course curriculum. HV, it's probably Dr. Feridunia explained it for you.
HV,
high voltage. She explained it for you?
Yes.
Okay. It shows actually she's so kind to explain it because it's not under your course curriculum. Okay. So interferential, you are familiar with that. The nice dynamic currents, as you can see, the kind of modulation ending, and the high voltage, the spike, a very high intensity, just a very short duration, probably 1 out of 100, 1 pulse out of 100, very short, or 2 out of 100, 200 milliseconds, microsecond, not millisecond. It's very small, short duration. And what a nice picture. You know how much I searched to find this kind of picture? Probably this is the only picture which I can show you for the hydrotrophy. You know the reason. Anyhow, in any case, this puppy, this dog, is under hydrotrophy simulation. Why we are using hydrotrophy? Why we can use hydrotrophy for some of the orthopedic disorder, especially fractures? Why? Because in the water, we have lower weight. Why? In the water, you have lower weight. If somebody does have 70 kilograms, 70, so in the water it can be around 9 kilograms. So why?
Because the water is
gravity.
high power.
When you are in the water, you will be lighter, equal to the water, which is equal to your volume. This is a physical rules for a person. You know his name. He's shouting "Eureka, Eureka" when he's escaping from bath. Belongs to 2,900, 2,800 years ago. Archimedes. Who was it? Archimedes. In Farsi we call it Arashmidos. Archimedes. Nobody knows him. You know? You know, at the period, the golden period of the Greek, there are magnificent scientists living together. Hippocrates, Hippocrates, Plato, Aflatun. I'm not sure, is it close to your mind or not? Archimedes, Archimedes. There are many magnificent scientists, all close together, close ages, close actually time. Because on that time, the society of the Greeks are heading to science. They are mostly starting the real science, or Socrates. And so, Archimedes was one of them. And he found this rule, this physical rule, and he said that, okay, this physical rule called buoyancy. Buoyancy. This is the name of the rule. So that's such as Jack Jones. Buoyancy. We call it being on the water. When you are in the water, you make me lighter, equal to the volume of water, which is equal to your body. Equal. For instance, I have a volume of, for instance, 60 liter volume, not actually weight, volume. 60 liter or 50 liter, okay, liter. Okay, when I went to water pool, when I went to water completely, so I will be lighter at the weight of the equal volume of water. Did you get my meaning? Right? You can check it at the name of the buoyancy rule or Archimedes rule. Archimedes rule. You can check it through the Google if you want. And you know, he was in a bath. This is a famous actually story. He was in a bath, Archimedes, 3,000 years ago. And a little less than that. he found that, okay, he became a little lighter, and then with lots of happiness, he ran away from the bath and say that Eureka, Eureka, that means I found. Eureka, Eureka. This is the Greek actually, Latin words, Eureka, Eureka. And this cute dogs found these rules, come to the water, because in water you can much easily provide a kind of movement. So if you cannot do that, if you cannot as the patient walk in the earth, so you can bring the patient into water. This is part of our job, into water, and he made it lighter. For instance, 70 kilogram person will be about 9 kilograms. So when the weight is lower, so you can easily walk. You can easily walk. We are using the buoyancy rules, buoyancy actually characteristic for our treatment. This is not very popular because it's too hard that physiotherapists going there and watch there what is happening for the patients. So it's part of physio. Anyhow, and he's training, providing some exercise. Okay, and this is physical therapist. Okay, and you know there are some specific weight, because you cannot bring the metal weight into the water. They got a kind of shrinkage. They got a kind of, how can I say, zinc under. Provide some zinc, the deterioration will be happen for them. But it's hard when you are trying to put it inside because it's located on the surface of the water. It's hard, it's a specific type of the weight. Did you get my meaning? Okay. And she's trying to explain everything for that. And okay, there are different methods of fixation. You know that we talk about that in orthopedic disorder, right? Do you remember?
Yes.
The plate, nice plate. Good to see you after a while. And come on, what was that? Come on. There is no retake exam. There is no extra mark. There is no job, there is no extra home actually assignment or something like that. Come on, you must say the name of this device.
Conversion.
Okay, say that.
Conversion.
So, you have a kind of short distance memory. Just remember it once and then lose it. I don't need it anymore. Put it aside. Just today, it's enough. Just pass the exam, done. I'm talking about all of you, not you, all of you. What was the name of that one?
Conversion.
Come on, dynamic compression plate. And what was the difference? It was locked. It was locked, the stability was higher.
Yes.
So you need this information. Don't lose them. Don't put it aside. Keep it on your mind, please. Please. Okay. God. And there are some actually different names, doesn't matter. But I'm thinking that I'm expecting that you know the DCP. DCP is very, it's easy, simple. This is buttons which is close to the area of the plateau of tibia, as you can see. Another type of the plate, 90-degree condylar, which is helping to provide a kind of compression between two condyles. And also the DCP, and again, this is a picture X-ray for 95-degree condylar compression. I mean, the 95-degree compression plate can be DCP as well. And when you see the DCP, you see that, okay, that the stability is good, it's high. So I can start as soon as I can start movement as soon as I can. It's possible. Okay, different type of the screw, we talk about that. There are different types, 6.5 millimeter, which is the most strongest or wider or the lowest amount. And the sliding screw, did we talk about that? I think. Yes. The sliding, which is helping for the neck and head of the femur. And you do remember this is a kind of weak point in the bones. What about the others?
Scaphoid.
Good. And just one and a half. Yes, it's very famous, it's very common. The scaphoid is common, the proximal part. Just one, half more to another bone. I told you in the ankle. You are right about this too. Thanks God. You never know. One person knows that. All of you knows that. What? What did he say? What did she say? Okay, just one more point. Navicular, the tubercle, which is navicular, which is somehow deficient circulation. Okay, but these two are much important. The scaphoid and also the neck of the femur. Okay, so you see the sliding cable screw and the wire. What is it called wire? Krishna wire. You do remember they put a kind of inclination at the end of the wire because somebody might actually use a kind of training for this one. If you cannot see the wires inside of the finger, so you may provide a kind of flexion, extension, something like that. Everything may be demolished. So we do have wire, and as you do remember, the wire will stay up to about 3 weeks, 18 to 21 days. It's exactly like intermedullary nail, which is here there are different wire, doesn't matter. Krishna wire. I don't have any feature for compression wire. This is a Lizarov method, and you do remember it's the name of a Russian surgeon, orthopedic surgeon. And some people right now using this one to increase height of himself or herself, something like that. It's too. There are lots of pain on there. I don't think that it's a good idea. This intermedullary nail is exactly like a wire, but the time of the stability is too higher compared to the wire. Okay, this person is after your hydrotherapy treatment come around. You know how much I look to find an appropriate picture and then find this picture for you. You never ever find any other picture for hydrotherapy. This is the only pictures. Okay. He or she is very happy. You know, I'm not sure. Are you happy with the pets, the house animal, something like that? The kitty, the cat, sometimes does have a very angry face. Okay, we call it cranky. Cranky is a term. It's a very furious and angry, and she or he wants to take off your head from yourself. And it's a nice word. Cranky. Bring it on your mind. If you see a person who was very angry and look at you, he is a cranky person. Okay, any question? I think we've done about the just classification. We do everything. We've done about the initial concept of orthopedic, and right now we are heading